This is one of the most common questions we get. Will I be required to purchase health insurance? The simple answer is yes. Starting in 2014, all Americans will be required to purchase health insurance or else pay a fine. Now this fine starts out the first year at $95. It slowly will phase in and eventually it will go up to $695 or 2.5% of your income. Now there are exemptions. You can be exempted from this individual mandate is what it's called. The exemptions are for financial hardship or religious exemptions. I think it's important to remember that currently about 85% of all Americans already have insurance. So we're talking about 15% of Americans, or 50 million, are currently uninsured. Of those uninsured, about 80% live in households where there are a full-time worker living in that household and they either can't afford insurance or their employer doesn't offer it. So what will happen under health reform is many of the uninsured will become eligible for Medicaid or will be able to purchase health insurance through the new health insurance exchanges. We're already seeing that young people who are often one of the most likely to be uninsured, we're seeing reductions in the number of uninsured young people because they can stay on their parents' insurance up until age 26. We don't want to get into the politics of the individual mandate. Ultimately, it will be decided by the Supreme Court whether the individual mandate is upheld or overturned and whether it's constitutional. But I think it's important to understand the philosophy behind having an individual mandate. The reason that Congress put this into the Affordable Care Act was because with health insurance, you want to create a risk pool. You're creating a pool of people. It's both healthy people and sick people, and you want them to balance each other out. So if you have a pool of people purchasing insurance and it's mostly sick people, you're going to have really expensive health insurance. You want to incentivize both healthy people and sick people to be in a health insurance pool. And so what the individual mandate does is say all Americans will participate in this health insurance pool nationwide, and it will spread the risk. So healthy people will balance out people who are sicker, and we will have everybody in the pool, which will bring down costs. So yes, there is a mandate, there is a requirement that all Americans have health insurance, and it's important to understand the background of that.